Hi, it's Dr. Dot, and today is day 2 of what I think is just a viral illness. I started with a bit of a sore throat and a dry cough this morning, and I reached out to my team and was instructed to stay at home. I tried to do some OTN this morning, and Dr. Gervais was able to call the hospital. I'm now waiting here outside the hospital for testing by the emergency department. So hopefully we will have that happening momentarily, and we'll get an answer in the next day or so. In the meantime, I'll continue with my self-quarantine. Okay, so here I am. I've just come out of the emergency department, and the nurses were amazing as always. They were quick to get me in. They brought me into a negative pressure room and gave me a mask. I had my temperature done and my O2 sats, and was swabbed, and that thing went deep into my throat from my nose. It was actually kind of uncomfortable, but glad that that's over. It takes about 48 hours to get the results, so I will lay low and try to do everything by telemedicine until I get clearance. And again, the emergency staff was 10 out of 10 as always. So here I am back home now in self-isolation, and I've got everything set up with my staff to start doing telemedicine. So here's my computer setup, here's my additional computer, and of course over here are my Lysol wipes, so I can continue to wipe down all my surfaces. Anyway, 48 hours, I'll sit here nice and quietly and wait for my results. So a few final thoughts just to help you prepare for COVID-19 exposure. The first thing we always talk about is prevention. So frequent hand washing with soap and water, cleaning your surfaces with Lysol wipes, and social distancing or avoiding public places as much as you can. The second is we want you to watch for symptoms. So most of it's going to look like a flu-like illness with fever, chills, and shortness of breath. If the condition's mild, just start with self-isolation and give us a call, and we'll try and get a telemedicine appointment arranged so that we can help you through that early time of diagnosis. If the symptoms are moderate to severe, where you're experiencing high fevers and shortness of breath, you need to call public health or go to the emergency department and identify yourself with those symptoms. Lastly, the highest risk patients for COVID-19 would be those who've gone to areas with known disease or have been exposed to another patient who has disease. And of course, we always worry about our patients who are at highest risk. So those with chronic disease such as diabetes, congestive heart failure, heart disease, etc., or those with immune modifying conditions, and those would be our patients with cancer or who are on drug therapies for conditions like Crohn's and colitis. So again, be very careful for the next few weeks. We're all on high alert, and certainly if you want more information, visit us at neomo.ca. We've put up 2 pages that will help you understand a little bit more about managing risk. One is about COVID-19, and the second is a page about telemedicine appointments and how they work. So please help us by reducing the number of non-elective visits to the office. And if you would like to see us, we'll see you virtually.